All right, the question I get a lot is, should you flex or should you extend? And this question usually comes from or stems from the fact that you've had an imaging done of some kind, probably an MRI. It will show a disc, problem, herniation, bulge, protrusion, and with that, a corresponding what's called stenosis. So you think about, okay, the word stenosis, that just means that there's a narrowing or something is taking up space. It doesn't belong in that hole called the foramina. So then you search and you're like, well, it says to do a disc thing, I have to do, probably extension. Then it says, well, with a stenosis, you can't extend, you have to flex. So then you're stuck. What do I do? Which direction do I go into? You have to think about the fact that there's a difference between a soft tissue stenosis and a hard, bony stenosis, okay? So it's likely that because the disc tissue is occupying space it's not supposed to be in, that is narrowing the space that nerve root has. Now, just because there's a presence of a stenosis, that does not mean that it's an issue. It doesn't mean that it's the cause or the origin of the pain. All it means is that a hole or a space has been narrowed down because something is taking, in that space, probably the disc. And then when you remove or you heal that disc issue, not only does the disc problem go away, but also the potential for the stenosis. So you don't have to worry about, should I go forward, should I go backwards? You have to test it. So use your knowledge of what makes your body feel better and worse to give yourself clues. If I feel worse when I sit, when I bend, when I'm driving on my computer for a long time, and that makes my leg pain worse, well, it's likely that the disc tissue is just getting pushed further in the way. As that gets pushed further in the way, it closes the space down even more, and that irritates the nerve. If I'm up, I'm walking around, I'm going to have a little bit of movement, I feel better. That gives you a directional preference that says, yeah, you have to at least attempt and try the extension. It's likely going to be the correct thing to do, and it's likely going to solve that problem, but you won't know that until you test it. So instead of becoming bogged down in fear with like, well, I've been told or I read on the internet to extend for this and then not to extend for this, and you're not sure what to do, test it and figure it out. So before you just throw them all to the side and not try anything, at least think about what positions, movements, activities make you worse. Set some baselines, bend forward one time, bend backward one time, hips to the left, hips to the right, and see, okay, if I test one direction, let's just call it, the extension, and I push up, come back down, press up, come back down. I do that a bunch of times, 10, 15, 20 times. Then I stand back up and my hamstring pain is less. It feels a little better. Okay, that tells you that whether it says stenosis or whether it says disc bulge, doesn't matter. You're responding to a specific direction and load. So you have to keep going into that direction and load.